Former President Bill Clinton, his foundation is pledging $10 million to battle HIV/AIDS and to deliver treatment to 10,000 children with the disease by the end of the year. His foundation will work with Dr. Paul Farmer and his organization called Partners in Health. Gentlemen, good morning. Nice to see you both.
Okay.
Mr. President, let me start with you. You know, are you sick of every interview beginning with how are you feeling? But that's, of course, what everybody wants to know these days because there is some concern about your health.
I feel fine. I think, you know, I had the second surgery and it completely opened my lung up again. So having both my lungs work has made a big difference. I feel good. I'm exercising and I'm working like crazy, so I feel really good.
Were your doctors slightly trepidatious about your trip to Rome?
No, they were okay. I cleared it with them before I went.
And they said no problem?
They said I would be more tired than normal because I was flying early, but otherwise I was okay. And that's exactly what happened. I had a wonderful time, but I was a little tired.
Let me ask you about your efforts, both Dr. Farmer and you, with AIDS, really worldwide and specifically in Africa. You know, as a former president, you have tremendous power and exposure to affect change. And you have really targeted AIDS as one of your most important projects. Why is that such a compelling issue for you? Because,
first of all, over 40 million people are infected with the HIV virus. Over 6 million people in poor countries around the world have full-blown AIDS and need medicine. Virtually all of them could live if they had proper medicine and care. And when I started, only about 170,000 people outside of Brazil were getting the medicine in any poor country in the world, and almost no children. So I'm working with my longtime friend, Dr. Farmer here, who has really worked miracles in rural Haiti to establish rural health care because 75% of the people with AIDS in Africa and Asia are in rural areas. And we're trying to get medicine to children because it's the children, really 1 in 6 people who die from AIDS are kids, but almost none of them get medicine because it's much more expensive, difficult, different dosage, different kind of medicine, and I want to do something about it.
Are there cultural taboos, too, that are preventing these kids from getting the medicine they need? The families don't?
No.
Well, maybe Paul can answer that question. Is it hard for these kids?
It's hard for these kids, but I don't think it's because of cultural reasons. I think it's there are significant economic and logistic barriers, and we can remove those barriers if we have programs like these in place.
Aren't a lot of these kids orphans, Paul, too?
Well, a lot of them are orphans, but again, preventing the orphaning is the big challenge, and that means providing good care to mothers, and there will be fewer orphans. So in this country, for example, in the United States, pediatric HIV disease is becoming a thing of the past. Not everybody knows that we're really wiping out AIDS among kids in this country. It just shows it can be done if we have the will and the resources to do it.
You all are working specifically together in Rwanda, is that correct? Although you're focusing on a number of countries throughout the world.
We're going to work in Rwanda because the government there is very supportive, and because the population of the country, about 8 million, lends itself to working effectively, and we think we can maybe establish some models there we can use throughout Africa and rural Asia. And also we have a lot of other people in Rwanda who are working. Catholic nuns, for example, have clinics there where they work with pregnant mothers to make sure they block mother-to-child transmission. So I think we've got a lot of partners there we can build with.
Speaking of Catholic nuns, is it disconcerting or frustrating for you all trying to stop the scourge of AIDS in countries like Africa? Catholicism is the fastest growing religion in developing countries. Is it frustrating that the Catholic Church will not distribute condoms and stop the spread of AIDS in that way because obviously it's against their doctrine?
Well, you know, in the field, working in places like rural Haiti and rural Rwanda, again, these haven't been significant barriers. We read a lot and hear a lot about how Catholicism or the Catholic Church, the institutional church, is going to block these sorts of projects, but that's not really been our experience. So I don't know. I feel we should give it a shot, and then if we're hamstrung by any institution, then we could say, well, we'll have to rethink this. But we have to try and fail first.
You think condoms are being distributed
I know
adequately?
we are doing a lot of that sort of work in Haiti, along with our other efforts, you know, around education and around caring for the sick. So it's possible to exaggerate.
And there are lots of countries, and Rwanda is one, where if it weren't for the church, the nuns in particular in Rwanda, a lot of these pregnant women will get no care. There's no difference in terms of the distribution of medicine, the efforts, other efforts at prevention. You know, different religious organizations have their own doctrines, but the people on the ground that we've worked with in Africa and in the Caribbean, particularly from the church, have been immeasurably helpful.
Do you think that Americans are engaged in this issue? Do you think they care?
Oh, I do, yeah. I think that as the tsunami showed, something else I worked on, the more people know about something, the more they care. The AIDS rate was worse in America when I became president. Then it's dropped a lot. But now it's actually coming back in some target populations. And Americans should care also in a very immediate way, because we have immigrants from all the countries where AIDS is raging. So we have a definite, direct impact. But on a humanitarian basis, I do think Americans care. Look, we finally, the president, look at the president's budget. We got over $2 billion for AIDS this year. The Congress, liberals and conservatives, Republicans and Democrats voted for it, so I think we do care.
Let me ask you one political question, if I could, President Clinton. As you know, Howard Dean is now head of the DNC. Right now, it seems the most effective thing the Democrats are doing on Capitol Hill is blocking various nominations, at least from their perspective, like, you know, the John Bolton, or U.S. ambassador to the UN, or head of the EPA, or head of the FDA. How can the Democratic Party retool itself so they're not simply seen as obstructionists in terms of the president's agenda?
Well, first of all, I don't think that's fair. I don't think Mr. Negroponte will be blocked. I'm not sure Mr. Bolton will be blocked. There are policy reasons on the environment and food safety for debates on the others. And on judges, that's just a hoax. I mean, the Democrats blocked 10 out of over 200 judges. The Republicans wouldn't even give a vote to 40 of my Court of Appeals judges, 4 times as many, just on the Court of Appeals, never mind all the others that they wouldn't have voted. So this image that, I'm sad to say, you know, you just perpetrated it. It's ridiculous. The Democratic Senate's been nowhere near as obstructionist to President Bush on judges as the Republican Senate was to me. Not even close. Now, they do have an affirmative agenda, but it's hard for them to pass it in a Congress where they're not in the majority. I think it's important always to talk about what they're for. I always did that. And I believe that, you know, we should be the party of ideas, the party of progress, and they should talk about what they're for. But it's hard to get it passed if you don't have a majority in either house. And a lot of times the best Democratic ideas wind up coming out of these conference committees where the members have some more influence. And I'm hopeful that particularly in the Senate, where there seems to be a little more spirit of bipartisan compromise, we'll see some of that.
Do you think your wife, Senator Clinton, has a chance to win the nomination and win the election in 2008?
I don't know. It depends on whether she runs. First of all, she's got a year and more to serve on her term, and she has to get reelected. And I think she will be reelected overwhelmingly because she's done a really, really good job for Republicans as well as Democrats. That's the bridge she has to cross, and she hasn't told me whether she's going to do it or not. And I don't think she knows yet. We've been in this business long enough to know you have to take care of what's before you. What's before is her job for New York, her job on the Armed Services Committee, which includes enormous challenges for the men and women in the armed services as well as the National Guard and the reserves. And then she's got to get reelected. She can't begin to think about this other stuff till she takes care of business. I've seen a lot of...
Would you like to see President Clinton one day?
I want her to do what she wants to do. I've said 1,000 times, I'll say again, I have no idea if she's going to run. If she did run and win, the country would be well served. I've never met an abler person in public life, and the job she's done as Senator from New York proves it. So, but if she wants to stay in the Senate and just keep doing what we're doing, I'd be very happy with that too.
Well, I think I've probably asked it 1,000 times. So, President Clinton and Dr. Paul Farmer, thanks so much for coming by this morning. Good luck with all your efforts in fighting AIDS, and we so appreciate you both coming by this morning. Thank you. Good to see you both.
Thank you.
It is 7:16 now. Here's Matt.
All right, Katie, thanks. We now turn to the Michael Jackson trial.
Tom Cameron Quaid.
Brett Huntley. David Bridget. John Chen. Tom Brokaw.